The Robert Wood Johnson Foundation Systems for Action Research Program and our regularly recurring Research in Progress webinar series. I see our participant count is going up quickly, so we're going to just give another minute or two, 30 seconds or so for people to get logged on, then we'll get started here. Well, again, welcome everybody. Thanks for joining us for the Systems for Action Research Program and our Research in Progress webinar series. For those of you who might be new to our program or to this particular event, this is something we do a couple times a month, and it's an opportunity for us to hear from research teams who are actively involved in implementing studies of aligning medical, social, and public health systems, and letting us hear in near real time about things they're learning about their alignment strategies, and how these findings can be helpful to our larger group of stakeholders around the country who are working to improve health and health equity by helping health and social service systems work better together. The Systems for Action program, funded by the Robert Wood Johnson Foundation, has been funding a whole variety of studies in this space, helping us to test new strategies for aligning health and social systems. And again, about twice a month, we come to you with this webinar series, showcasing one of our research projects and one of our research teams, and letting us take a deeper dive into what those teams are learning. For today's session, we are really excited to be joined by our research team based at Visible Network Labs and the Glasser Schoenbaum Human Services Center down in Florida, who've been doing some very interesting research using network theory and network analysis methods to understand health and social service system connectedness and capacity to address health and social needs for populations. And so we will introduce our team. And let me first introduce our member of our SRA National Program Office team based here at University of Colorado, Annika Goldstrom, who I think, Annika, do you want to lead introduction of our speakers for today?
Sure, I can do that. Thanks, Glenn. So today for our presenters, we have Rose Hardy, Danielle Varda, Charlene Altenhain, and Cameron Hodgins. So Rose Hardy is a network data scientist at Visible Networks Lab. The goal of her research is to ensure that all communities receive the quality care they deserve, provided by systems that address their needs and acknowledge their strengths and wishes. Charlene Altenhain is the executive director at Glasser and Schoenbaum. She's a lifelong resident of the Manatee and Sarasota counties in Florida, and she has a deep commitment to her hometown community. Danielle Varda is a scientist turned startup founder, leading Visible Networks Lab as a CEO. She leads the Visible Network Lab strategic partnership approach and is the company's lead fundraiser and has a vision for how to utilize network science to solve our most pressing and intractable problems. And lastly, we have Cameron Hodgins. She is the director of community leadership at the Gulf Coast Community Foundation, and she was previously the CEO and executive director at the Glasser and Schoenbaum Human Services Center in Florida. Now I will turn it over to Rose.
Thanks, Annika. Always takes me a second.
Well, Rose is getting started. Just a reminder, we will have time for questions and during the latter half of today's session. please use the Q&A button down at the bottom center of your screen. You can type your questions in at any time during the presentation, and we'll make sure that our presenters get to those during the latter part of our session today. So Dr. Hart.
Thanks, Glenn. So thank you all for joining us today as we talk about social need referrals from the hospital setting and how we measure that carrying capacity in the community, and how we've looked at that during COVID-19 pandemic, the COVID-19 pandemic. I know that it's been mentioned, but I'll start by saying that we've had the pleasure of working with Charlene and Sarah at the Glasser Schoenbaum Human Services Center, and Cameron now over at Gulf Coast Community Foundation, but previously at the Glasser Schoenbaum as well. And of course, Danielle and Amanda at Visible Network Labs. So this is a pretty talkative and lively group of individuals. So they may jump in at points during the presentation and certainly during the discussion section. And I'm grateful for all of their insights and hope that they will jump in as we go forward. So to start, we started working together back in 2017. At that time, the project was looking at two communities specifically, so Denton, Texas, and Sarasota, Florida, that both have robust human services networks that were serving their communities. And the aim of that work was to see how community-based organizations were able to absorb the increased social service referrals that were coming from their hospital systems. As screening for social determinants of health in hospital settings becomes more common, understanding the impact of community organizations is going to become important if we want to truly address the needs in the community and to improve population health. At that time, both networks were surveyed to understand sort of that cross-sectional relationships in those networks that were implementing those screening, referral, and follow-up processes. And to understand that from a network science lens, particularly and specifically. In Sarasota specifically, there's been a robust network that's been working together for many years to provide these services and works across sectors to address the needs of the community. And so when the COVID-19 pandemic began here in the US, it was an opportunity to see how an established network handled that actual increase in demand for social services rather than just what we sort of thought would happen. So to that end, we started asking a couple of different research questions related to the impact of the pandemic on carrying capacity, as well as how network structures and relationships have helped or hindered the network goals. So network science, looking at those structures in organizational relationships and their quality can help us understand how a network can achieve the goals that it sets out for itself. In addition, we wanted to see what could be learned and used in other communities when such emergencies and public health crises occur in the future. So since the last time that we've done one of these research and progress presentations, we did a webinar to network organizations to introduce the study, talk about why it would be important for them to participate. And then in the spring of last year, conducted the network survey itself. And then through the summer have worked to analyze those data. Since then, we had another webinar to communicate some of those general findings back to the community. And then we've also done some sub-network analyses. So in particular, we've analyzed how the foundations have worked within the network, as well as how health systems have, behavioral health, the First 1000 Days Network, which is a group that focuses more on maternal and child health there in Sarasota, and then how the organizations on the Glasser Schoenbaum Human Services campus have interacted during the pandemic. Since doing those analyses, we've created several short briefs and webinars for interested parties. And in fact, our last presentation to the health systems is scheduled for later in this month. So given all of the analysis and the conversations with the Glasser Schoenbaum team, it's fun to finally get to share some of those results with you all. In the original project, the Sarasota Network was smaller. There were 41 organizations with a pretty high response rate of 73% and a total of 612 relationships reported. In 2021, we expanded that list of of organizations to 88. And the response rate was still pretty high at 76% and a total of 1,605 relationships reported. So pretty robust and active networks both times. One of the things that was asked in the previous survey was about how quickly they would be able to expand services given their current circumstances. And then in the 2021 survey, we asked about how quickly they had been able to respond to COVID-19 specific changes. And we see that they both thought they could respond pretty quickly before COVID-19 and perceived that they had been able to respond quite quickly to those specific changes. Or sort of put another way, their perceptions of their abilities to activate a network appear to be pretty well in line with what they think actually occurred during the pandemic. So these were some of the primary services that were provided during the pandemic, with social support and guidance being one of the most common services that was provided, but certainly mental health and behavioral health, access to care, and financial assistance were also frequently mentioned. All of the organizations were asked about their partners during the pandemic, and this bar chart shows some of the primary services of organizations that were partnering specifically with the health systems and the clinical care organizations during the pandemic, giving us sort of a sense of the types of services and needs that were being referred out from health systems into the community. And they're slightly different than the whole network, but social support and guidance remains most common. That said, some of the other common social determinants of health, like food and housing, were services that these organizations were providing as well. In addition, many of these organizations worked with the health systems and clinical care organizations, and they reported that their interactions were related to client referrals, as well as information exchange. And then when asked about the outcomes of these interactions, the exchange of resources and improving the community's capacity to address unmet social needs were sort of the most common outcomes that were reported. Organizations were also asked about their level of collaboration during the pandemic. So we look at collaboration from sort of that low level of basically we only attend meetings together, up to integrated activities, or sort of a higher level of collaboration, with this thought that as you increase in collaboration, it requires more time and more resources, and organizations may have to think about it carefully in terms of how they want to spend their time and do that effectively. So during a stressful time like this, one might imagine that some of those more time-intensive or resource-intensive activities were more limited. And we see that a little bit in the reported data here, where cooperative activities like attending meetings and information and resource exchange were more common than some of these higher levels of collaboration. That said, there's still 21% of reported relationships that appear to involve the integrated activities, or sort of that highest level of collaboration during the pandemic. As we think about the social need referrals into the community from health systems, looking at how partners view each other is something that we considered important as well. We looked at how health system organizations viewed their social service organizational partners, and how social service organizations viewed their health system partners. We measure value in a couple of different ways. So their perceived power and influence in the network, their perceived level of involvement, and their perceived resource contribution. And here we see the network average for these scores in blue, The green bar is how social service organizations view their health system partners, and the red bar is how health systems view their social service partners. So while the differences are small, we tend to see that social service organizations valued their health system partners more than health systems valued their social service partners, particularly when it came to power and influence, as well as level of involvement. When looking at how organizations trust their partners, we can look at their perceived reliability, their mission congruence or alignment, and their perceived openness to discussion. Both health systems and social service organizations tended to have trust in their partners, although we see that the health systems perceive their social service partners to be more open to discussion than social service organizations perceive their health system partners to be. That may not be surprising to people here. Cameron has talked about this before, but there was a perception that in some ways the pandemic felt like everyone sort of grabbed each other and held on tight, but didn't necessarily know what was happening within the network as a whole. And that's something that we, in fact, see in the data as well. So when organizations were asked about the successfulness of different aspects of the referral process, many felt that they did not know how well it was going. So while partnerships and meetings were seen as pretty successful, things that they had eyes on, right? Other aspects were less well understood. Although many of these organizations were involved in the first 1,000 days network, so one that is more involved in the referral process and had access to things like that centralized resource tools like U9S. Some of the aspects of data sharing and understanding the outcomes of the referral were less clear to organizational partners. And while the referral process was less well understood, there was still a perception that social service referrals were increasing during the pandemic, making this lack of understanding a little bit more concerning. However, this network also felt like their ability to provide those services during the pandemic was not particularly adversely affected. In fact, a third of behavioral health organizations perceived that COVID-19 had significantly increased their abilities to provide services, and the rest felt it had not changed their ability to provide those services.
Hey, Rose, I just want to jump in there real quick and say the main reason for that was the ability of telehealth, and which made transportation barriers go away. So individuals who couldn't get to behavioral health appointments by vehicle or public transportation were able to jump on their phones or make a phone call and have that same therapy session. And some of our colleagues in town have said, you know, and we'll never go back, right? So keeping that telehealth as a really good way to reach their clients, I think, is here to stay.
Yeah, yeah. It's interesting to see the ways that telehealth can be used effectively, for sure. There's a little bit more variation in the social service organization perceptions, but still over half felt that it had increased their ability or had not changed their ability to provide those services. And so that led us to think a little bit more about what factors had really helped during this time. And as Cameron said, telehealth was certainly one of the things that helped behavioral health organizations feel like things were going well. But other things like health phone lines, referral platforms, and their community relationships and provider camaraderie were also seen as valuable during this time. And then when looking at some of the funding sources during the pandemic, donations, grants, foundational support, and COVID-specific funding were frequently mentioned as well. Most organizations felt that they were stable or very stable during 2020 and in 2021 and beyond. Then it was slightly lower in the previous survey in 2018, although you'll see here that most organizations within the network felt pretty stable regardless. And one of the things that we think may have helped with that has been the foundations. And so based on some of the conversations with Charlene and Cameron and Sarah, we dug a little bit more into how the foundations were working during the previous network and during the pandemic. And we found that the more of the foundations were collaborating with one another during the pandemic than were back in 2018. So here the pink circles are the foundations, and larger circles mean that they had more reported relationships with others in the network. And then the lines between them are those reported relationships between the foundations themselves. And during the pandemic, we see more relationships between foundations and more reported bidirectional relationships, meaning that both organizations reported to be working with one another.
Yeah, Rose, during the pandemic, especially when it first started, the foundations were very generous and contacting agencies, especially key agencies in the community, and asking, how can we help? What can we do? Where are your stress points? What's the best way? And even when that answer was money, money is the best way to help us at this point. They made that happen, and they made it happen quickly. And so that was a key benefit to keeping a lot of our agencies moving and providing services in the beginning.
The SF there in the middle on the right side is a foundation, private family foundation that upgraded many nonprofits' technology systems just basically on a phone call and said, we have to go work from home. We don't have the equipment to do it. And they were extremely generous in getting nonprofits as up and running as possible during that shift.
Yeah, we'll talk about it a little bit later, but we are doing these qualitative interviews, and I noticed that one of the things that some of the foundations have mentioned is that they were able to give for services that weren't necessarily sexy, right? They're just like the things that you needed for the basics, or that didn't necessarily give them a whole lot of press at this time. But you'll see that the foundations were certainly active both before the pandemic and then during the pandemic. So back in 2018, they were connected to about 88% of all of the organizations in the network, and 20% of reported relationships were with foundations. And then similarly, during the pandemic, connected to 82% of network organizations, and 22% of all reported relationships were with these foundations. The perceptions of the actions of the foundations during the pandemic also made us look a little bit more into the ways that they interacted with their partners. And we find that more of the organizations that were connected to the foundations reported that they could quickly or very quickly respond to COVID-19 specific changes compared to those that were not connected to foundations. So some of the next steps here are to do the qualitative interviews with members. From some of these findings, we're particularly interested in looking about the role of the foundations during the pandemic and how behavioral health has functioned and done well during the pandemic, and things that we want to understand as well, are things that we want to understand as well during our interviews. There are, of course, other questions from the research aims that we want to pursue as well, including sort of how the experience in Sarasota can be understood and used for other networks as they prepare for emergencies and public health crises like this, and tools that can help us better understand what happens during a stressful time like this. Additionally, I think as we enter this new stage of handling the COVID-19 pandemic, there's room to better understand how we move forward from this acute stage of a crisis back into whatever phase of the pandemic we're in now. and determine what pieces of this experience need to be continued and what pieces were valuable during that acute stage, but may not be necessary now. And with that, I'm going to stop sharing. And I think we're going to open it up to talk a little bit more about lots of things, but sort of the engagement with the community and thoughts about sort of what the next phase of this all might look like.
Rose, I can jump in there if you want me to.
Yeah.
Or Annika. Okay. So many of you on the call are probably familiar with Florida is a bit of the wild, wild west in many ways right now and has been throughout this whole process. And so when you drill it down and look to your local community and caregiving and caring about humans and their outcomes, it really did sort of fall on the lap of healthcare providers and the human service community. For those of you not familiar, Glasser Schoenbaum is a nonprofit center. There are 18 co-located human services on one 5-acre campus. And by nature of our design, we are a network. And we were able to activate that network during the thick of the pandemic and had colleagues who were literally setting up their garages as service distribution sites for helping the people that needed help. And at the same time, like Charlene mentioned, the foundations were calling some of us and saying, what do you need right now? And that was the first time that those barriers, those kind of power dynamics had melted. And it was really refreshing to see. And then realizing, yes, we're all in this together and we're all learning in this together. The hospitals, we have one really big behemoth hospital in town, and they have evolved during this time, and watching them realize, and I would have to say, and this is not throwing anybody under the bus, their focus on social determinants of health and diversity, equity, and inclusion and healthcare disparities has actually really transformed during this process. And they did participate in our 2018 study from multiple site directors. They have multiple locations throughout our county. But this time it was almost even more with a new revelation about how important health equity was in this journey. And so we're very grateful that they participated and they were part of these discussions. And the foundations in town were paying attention to what their issues were and where their pain points were. Rose had mentioned this, but right before the pandemic, our community adopted the Unite Us platform. We've had 211 here for a long time, of course, and some other sort of small just community networks. But we really saw the heightened activation of all of those systems. And even to the point that agencies were still learning how to use the Unite Us system, and we're sort of all drinking from a fire hose, trying to meet everybody's needs, but keeping that training front and center for people on how to use it to bring clients on, how to accept referrals, how to grant referrals. And then I think, and if I had to say, what we're struggling with the most right now in our human service network is just staffing. And I know we're not alone in that. And some traditionally really major nonprofits in town struggling, not only with regular, boots on the ground staff, but even at the highest levels of leadership. And seeing that and sort of the instability in that space is actually kind of, it's very concerning to me, linking it back to who we know is really doing this kind of hard boots on the ground work during a pandemic, where it was a lot of the human service groups. And so when their leadership and their foundations aren't strong, it's really quite concerning. And we're seeing sort of cracks in the armor there. And now that I'm on this side of the fence in foundation work, part of our job is to say to those organizations, what can we do to support you in being stable, realizing the value within the community?
And there are some pieces that even, when you look at the backbone of service providers in our community, like Salvation Army, who I'm sure is a similar function in a lot of your communities, when they are starting to look at their services and reduce the number of services that they provide, you know, that's when everybody sits up and takes notice and starts to look at, you know, how can we help? What can we do? And it's across the board. Like Cameron said, it's just a very big question mark that is looming over everybody. And we don't know if this is the next phase of the, you know, the ripple caused by the pandemic and what all of this next phase is going to look like. And it's just big question marks, like I said, that are just hanging out there.
You know, and we hear from all across the country, healthcare workers with that compassion fatigue, you know, nurses resigning, the whole thing. Definitely the same thing in the nonprofit community and human services, for sure. And, you know, there are organizations in town who are teaching resilience. And, you know, the nonprofits are bringing them in as we can to help bolster our staff, but it's no joke. Sarah Keegan, I see your question here about what platform did they use to distribute the surveys. So I will let Rose and Amanda talk about that, but the one that I was talking about is called Unite Us. And there are other corporations in the country that have platforms like that. It just happens to be the one that a funder here and the hospital adopted. But there's, you know, Aunt Bertha and some other technology programs. But for Amanda and Rose, could you talk about the survey, how that was done?
Amanda, you look like you were about to. We used here at Visible Network Labs, we have a survey tool called Partner that we used for the network survey itself. So do you want to add on to that?
It is a exercise in patience and perseverance. It's a lot of questions, but it's really revealing about how your community is working in their networks. And what's most interesting, I think, about it is the perception between the organizations. So that trust and value score, how much are you trusting each other? How much are you valuing each other? How much are you bringing resources to the table? Obviously, foundations are going to score higher on that resource piece. We know that they have dollars behind them, but you know, Glasser Schoenbaum has a grant program where they give some money out to each organization on the campus once a year, and so, you know, in a sense, they're a grantor as well. And so it's really interesting to complete that survey as a community and see how that network is functioning. And I think if you're in the nonprofit world, or you're in foundation world, or you're fundraising at all, this kind of data is so valuable to show people in your community, no, we are not working in silos. You know, anytime I hear that, and I've been in nonprofit world for 15 years, I love to show our spider web and say, this is how non-siloed we are. We cannot be siloed in to get our work done. And boy, was that really obvious during COVID.
And it does help with grant opportunities, because a lot of the funders ask on their grant applications, you know, who do you work with? You know, who is partnering with you in this program that you're asking for these funds for? So having this data is extremely helpful. And for anybody that doesn't know what Unite Us is and maybe familiar with 211, 211 is an information and referral source. Anybody that has any kind of need can call 211 and ask, and the person on the other end of it has been trained to ask questions to get to what it is that you need, and then to refer you back out to agencies in the community that can help you. Unite Us is a closed loop referral system that goes from agency to agency. And that's the difference there is, you know, if a client is seeing an agency for whatever purpose, whatever need that they're asking for assistance with, and that agency sees another need that they don't help with, they can refer that person out to another agency in the community, and then they can see the results of that. So even though the First 1,000 Days group has started to use that program, back when the survey was taken, it wasn't widely used and widely understood yet. And I think that's one of the reasons, even within the First 1,000 Days network, they talked about not knowing how the referrals were going. They were using the Unite Us, but they probably weren't using it to its full capabilities and didn't understand it across the board. but it's an exciting opportunity for the community to see how that platform works and to then move it into other areas and other sectors. I know there's already conversation about moving it into the behavioral health sector. So it would never, well, in its current form, it wouldn't take the place of 211 because there's no point of entry for a client without going through an agency. So 211 has the ability for a client, for an individual to ask questions that isn't connected to an agency. So until those two work together in that format, we're always going to have some separation there.
It's interesting too, because the data that comes out of Unite Us, which they have like a dashboard, real live type thing you can pull anytime, or you can search by any filter. Taking that data and looking and mapping it onto this is very interesting, because Unite Us initially was saying, oh, Sarasota doesn't have any financial assistance. And it came up that the need was in our survey. And Charlene, we were like, oh my gosh, we have lots of financial assistance programs. And so you're realizing like those individuals aren't in the system, or their program was turned off, or somewhere, somehow people in our community were not able to access that piece, which as you know, there was quite a bit of money in most communities from ARPA and ERA and other money coming down the pike. So it gave us an opportunity to really think about where are we missing the mark and messaging what is available to people in need. And then when we saw the Robert Wood data mapping on top of our community-based data, it was just all the more, okay, light bulbs on everywhere about which aspects of social service delivery needed more work or more attention.
And Cameron, do you remember when we did the original survey in 2017, 2018, the point that everybody found unique was how integral the local law enforcement agencies were to our community. And when we did these types of research and progress webinars and spoke about it in other formats to other communities, they were like, gosh, we can't believe how, that you work so closely, that your community works so closely with the police department and the sheriff's department. And what's unique about Sarasota, I think, is that they might be local law enforcement, but they're also a social services agency for us. I mean, they have the HOT teams, which are their homeless outreach teams, and they are, it's just an integral part of our social service delivery system here.
Yeah, about three things influenced that, and it was a rising homeless rate. Yes. It was also trauma-informed care training that the whole police departments, city and county went through. And then just a recognition that they were the first point of contact for many people in crisis, and how was their response, going to affect the care of the person that they were helping. The other piece is human trafficking is unfortunately a major issue in Florida through our bigger cities, but it was a real problem here in our community too. And they received a lot of training within through the trauma-informed care lens on intercepting individuals involved in human trafficking. And those components, yes, made them look very compassionate and have a very different relationship with community providers. So I'm just checking the chat here.
Yeah, Annika or Glenn, I'm wondering, we have a participant who has their hand up. I'm wondering if we can take that question now, if you could help us with that.
For sure. I did not see participant. If you do have a question, feel free to ask it, or just type it in the Q&A box so we can see that and address it.
Two things that I wanted to mention in both the 2018 study and this one. One area that our network studies showed that our community needs better cohesion on, or better coordination, is discharge planning and follow-up with the people that we serve. So that's fascinating. And I kind of think that's a moral gut check for our community. So, you can imagine you get involved in your daily work and your daily grind, and you're receiving clients and you're doing what you're doing, and you're saying, okay, they're done. Now they walk out of your office. Well, I don't count recidivism rates or back through our door as a bad thing. It's just maybe they're not coming through our door, but maybe they're going down the sidewalk at Glass or Schoenbaum and seeing another partner. We're not talking about that piece. And what is our community's commitment to wellness, to long-term wellness, and people's lives, right? Things are going to happen, but what can we do as a community to know that a certain member of our community may be bouncing through services and really is kind of a high user, right? We don't really know that. And yes, we work together to initially connect the person and say, oh, well, Susie down the sidewalk may be able to help you better than us. But then there's kind of like no follow-up with what happened with that person. And even in a tech platform such as Unite Us, you could go in there and technically see that somebody was discharged from a service provider, but really, what's their long-term outlook? How are they doing downstream? So
No, you're absolutely right. And it's not anything that we're all thinking about it now. We may not have been thinking about it before, and COVID definitely has shined a light on those types of inequities where we're working with a client now who was discharged from the hospital and into rehab, and their rehab is quickly coming to an end, but then they have nowhere to go from there, and they will still need continued medical care. And so, where are they going to go? And in the past, it wasn't really, it was just at that point, it was the rehab facility or whatever the organization was, it was their job, so to speak, to find some place now for them. And it quickly came to light that there were breaks in that communication cycle. And now we're all trying to figure out how do we accomplish that. Cameron mentioned staffing is an issue. I'm sure staffing is an issue everywhere where you are as well. My feelings would be that would be the case. So how do we staff for that position? How do we get that paid? What grant opportunities are available for that? How, what does it even look like when it's, several different systems that are being used, several platforms, and data isn't shared readily across multiple platforms. So it's definitely a concept. It's definitely a concept that is widely recognized, and we're all waiting for that answer to come hit us in the face. We're ready for it, and we're still working on it.
I think we've heard in a couple of these interviews about sort of the flexibility that you had during the pandemic in terms of giving money, and also a sort of less competitive nature. There was more collaboration, and I guess I'm curious, to what degree do you think that's going to continue, and in what ways should it or be useful in the future?
I think that was one of our fears in nonprofit world is this kind of power dynamic that's crumbled going to remain, and how are the foundations going to move assets forward coming out of this, and what are their donors going to do? Because they've got a lot of DAF money, right? Donor advised funds. I can speak for Gulf Coast. That there are three priorities of our team this year is affordable housing, mental health, and environmental sustainability. And so affordable housing and mental health, those came out, yes, they were here before the pandemic, but really some fuel thrown on those fires during the pandemic. So and by the way, I personally had nothing to do with choosing these three. They were already there when I got here, but I'm proud of that because those are probably mental health and affordable housing are two of the biggest issues that came out of the pandemic. And in this part of the world, a lot of individuals with, lots of wealth moved here during the pandemic, driving up the prices of our housing. And so, however, our community is largely hospitality based and those wages didn't change. And there is no rent control in Florida. So landlords were able to just jack up their rents as much as they wanted to and still are doing it at an unbelievable pace. And the wealth that moved here during the pandemic, they're able to cash buy these multi-million-dollar homes and pricing people out of their own neighborhoods. And so that was related to the pandemic. It was already high, but it's just really, really inappropriate, in my opinion, for our wages. Florida's wages remain low compared to other parts of the country. So this foundation is going to keep an eye on that affordable housing, really being an advocate in governmental space to make sure some of those ARPA dollars go towards building more affordable housing units. There may be a project going on this community or in that neighborhood to the tune of 200 units. We're like 30,000 units short in our community, and that's probably even an antiquated number. As far as mental health, again, the goal number 2, pandemic, it's a staffing issue. Many of our nonprofit partners have mental health programs in their walls, but cannot keep staff or find staff. So some of the foundations are supporting those individuals who are interested in going into the field, completing their degrees, paying for the education. I don't think that's going to stop. And also teacher burnout, teachers, trying to keep teachers in the teaching field as a result of pandemic burnout. And some of the foundations in town are putting assets there. So I can say with pretty good confidence that the foundations in this community are definitely paying attention to, I'll say COVID fallout, but it really, again, it's Florida, we're still right in the middle of it, how COVID is affecting our community.
And I think, from a nonprofit standpoint, it really becomes down to relationships. I think during the pandemic, even prior to the pandemic, nonprofits had well-developed relationships with foundations. And then the foundations came in and basically relaxed a lot of their grant requirements to get money into the hands of these nonprofits quickly. And, as to whether or not those requirements are going to come back into play, I think a lot of that does have to do with the relationships that have been built during the pandemic and these new tests that are coming to light about, as Cameron was saying. So I think the pandemic, even though, horrifying and a tragedy that it was, this might be one silver lining, very small, but a glimmer of something to say that I think out of it, our foundations have really taken a look further into what can, the help that's needed from their end to the community, and maybe what their responsibility is to the community. So thankful about that.
But even our community, so we have something in Sarasota called the Giving Challenge. Many communities across the country have a 24-hour giving marathon online. And this year, compared to last time they did this, was about a $2 million deficit compared to the year before. And so, I'm thinking, is that donor fatigue? Is that compassion fatigue from donors who are like, man, geez, are we over this? I'm going to keep my money. Is that their portfolio performance, right, in the stock market? Like what's affecting individuals who are trying to help others at this time? And for our community, that was a noticeable deficit this time around. And who knows? So yeah, I agree with Charlene. How are our relationships? How are we articulating what we're doing and our value to the community? How are we making those partnerships? That's one thing that we discussed a lot of times on these calls with Robert Wood Johnson. Some of you coming from academic institutions ask me, how do I make relationships with community partners like you, community-based organizations? And it's really relationships. Who do you know that's working at a nonprofit? Do you have a nonprofit center in your community? There's a great resource online, the Nonprofit Centers Network. There's a map of all of us across the country. And so you can put in your zip code and see what nonprofit centers may be next to you, and could you partner with them for your work? You'd be shocked to see how many are around you, and then the breadth and scope of their missions, right? And who they're serving off of that campus. Nonprofits are starving for partnerships like that. We could not do this work, or Glasser Schoenbaum could not have done this work without Danielle and her team, and Amanda and Rose. We're not the scientists or the data tech people, right? But we're the community people. So we needed each other to make this work shine.
Yeah, well said. So Rose mentioned during the presentation about some sub-networks, and we talked about the first 1,000 days and the behavioral health network, the healthcare network, and then the Glasser Schoenbaum campus. And we took those individual sectors, and the NL team actually took the data and took data for those individual groups and actually put presentations together, and we did presentations to each of those individual groups about their data specifically, comparable to each other and then comparable to the larger group. And that was very interesting for those to see. Oh, I'm sorry, we also did the foundations. So those were very interesting to see how they interacted amongst themselves and scored themselves with regards to trust and value. And then we had, let's see, it was actually Glasser Schoenbaum's group. I should be smacked for forgetting this. The value scores, we talked about the value scores in and among the larger group, and that's the social services organizations didn't rank quite as high on the value scores. And when we look at the Glasser Schoenbaum group, they themselves actually scored their value with each other higher than the group at large. So when you start to look at these sub-networks, and then you can start to see how well the sub-networks start working together and how they start acting and interacting, then it becomes really interesting to see the value in those types of relationships, even though they may have interactions and relationships outside of their own sub-network. When you start to look at these sub-networks and how they interact, I'm doing this because I'm imagining the spider web.
Yeah. Go ahead.
Go ahead, I'm sorry.
Rose mentioned, how can we use this data to kind of learn and plan for, oh gosh, don't even say it, right, the next awful community pandemic that we have. If I were to say one piece of advice in all of this is know where your power pockets are and know who is connected to who already. So what networks are already in your town? For example, many communities have disaster preparedness coalitions, right? And in Florida, those are a thing for our hurricanes, but are there already groups in your communities working together for similar causes? Either they are all sharing the same type of mission, or they're all coming from different places to like come together for disaster preparedness. So figure out where those are and leverage those relationships. Number two is, who are the power players? Where are the assets? And do those entities know your pain points? Do they know what could be your challenges next time around? And if they don't, it's time to start building relationships, and it's time to start reaching out to people. Even if it's uncomfortable, you never know where those conversations are going to go, or how those power players can really help you. If that's your local government, if that's your local government leaders, or we have a really active health and human services department within our government. Our local government, do you know those leaders? And they're not the county commissioners, but they're one or two steps removed from them, but they are very influential. And also their fingers are on the pulse of human need in your community. Where are those people, and how can you use your social capital to connect with them? Is there another? I see another Q&A here. Let's see, that might be Christine. Okay. That's an internal question. Okay.
Fantastic. Thank you again to our great group of panelists for sharing with us their work today. And thanks to everybody for joining us for this latest edition of our Research in Progress webinar series. I hope you all come back to, we've got an exciting slate of future S4A research projects on deck throughout the summer. And otherwise, enjoy the rest of your day. Thank you so much, everybody.
Thank you. Thank you to Robert Wood Johnson too for the funding. It's been really incredible.